HighBridge, a division of Recorded Books, presents The Brain on Cannabis, What You Should Know About Recreational and Medical Marijuana, by Rebecca Siegel, M.D., with Margot Starbuck. Read by Chloe Cannon. Forward, by Daniel G. Amen, M.D. As a psychiatrist, neuroscientist, and brain imaging expert, I meet with many patients at Amen clinics who have questions about cannabis. Is it a harmless substance? Can it help with anxiety? Does it cause psychiatric illness? Is it dangerous? Is it addictive? Is medical marijuana different than recreational pot? What's the difference between CBD and THC? Is cannabis bad for the brain? I typically explain that our brain imaging work at Amen clinics has shown that chronic recreational marijuana use can prematurely age the brain, which explains why I am not a fan of long-term recreational use. However, I am well aware that medical marijuana does have some therapeutic uses and can be helpful to some people with certain conditions. From there, it can get trickier to explain all the important details about this substance that has been making headlines since being legalized in several states. Now, I can point my patients to The Brain on Cannabis. This exceptional resource from Dr. Rebecca Siegel, one of the psychiatrists at Amen clinics in the New York metro area, who is certified to recommend medical marijuana, covers everything you need to know about cannabis and medical marijuana. In this well-researched book, Dr. Siegel debunks the myths surrounding cannabis and explores the promise of its many therapeutic possibilities. She shares how the natural herb has proven beneficial to some, including those with insomnia or chronic pain, people undergoing chemotherapy treatment, and individuals suffering from post-traumatic stress disorder, PTSD. She also outlines the most qualifying conditions for medical marijuana in the states where it has been legalized. This compelling book also examines the scientific research showing that cannabis may affect people and their brains differently, depending on age, gender, and more. And she thoughtfully investigates the potential downsides of cannabis, especially with regard to brain health. She points to Amen Clinic's brain SPECT imaging studies showing that in heavy cannabis users with Alzheimer's, marijuana use can damage certain areas within the brain. She also presents research showing links between marijuana use at a young age and increased risk of psychiatric disorders, such as psychosis, anxiety, depression, and substance abuse. Because of this association, she makes it clear that because the brain continues developing until a person's mid-20s, she doesn't recommend the psychoactive THC in younger people. This book also takes a fascinating look at the history of cannabis, including the discovery in the 1990s of the endocannabinoid system, the body's natural producer of cannabinoids, and its involvement with mood, sleep, memory, appetite, and fertility. Ultimately, The Brain on Cannabis delivers an important message that medical marijuana isn't a one-size-fits-all therapy. There are many different types of therapeutic cannabis and a variety of delivery methods. In addition, people can react very differently to it. So even if it worked for a friend or family member, it may not be right for you. Working with a doctor who is certified to recommend medical marijuana to determine if it might be beneficial for you is critical, as is following up to address any possible side effects or adjustments that need to be made. With an engaging writing style, Dr. Siegel offers step-by-step advice for discovering whether cannabis may be an option for you and which delivery methods are available. This book also demystifies the ins and outs of the medical marijuana prescribing process. For anyone who has ever wondered about medical marijuana, cannabis, THC, hemp, or CBD, this book can help you navigate your way. If you are considering using cannabis as a form of medical therapy, or if you are simply curious about this fascinating substance, The Brain on Cannabis is a go-to resource you can trust. Introduction. My journey to a greater understanding of cannabis. As a teen during the 1980s, I was raised on the stereotypes about marijuana that were popular at the time. In high school, I believed marijuana was for potheads, who were most likely underachievers. Like many, I tried marijuana in college, but because my experiences were not very good, I mostly stayed away from it. During medical school in the 1990s, there was certainly no mention of the potential medical benefits of marijuana anywhere in our curriculum. When I married and had children, I knew I didn't want them using marijuana, but quite frankly, I simply didn't give it a lot of thought. Several years ago, though, I started thinking about it a lot. I'd been treating 43-year-old Jennifer for anxiety and ADD for about 3 years when she asked for help with insomnia, explaining that she'd been struggling to fall asleep for 6 months. Jennifer's sister, who also wrestled with insomnia, had had success with prescription sleep medication, and Jennifer was hoping it could help her as well. I began by explaining that I wasn't a huge fan of many sleep medications because they can be habit-forming, and some people taking the medication do things while under its influence that they have no memory of at all. Waking up the next morning to discover you've polished off the leftover lasagna in the fridge is relatively harmless, but some people have later discovered that they'd been driving while taking medication, with no memory of the previous night. Weighing Jennifer's needs against my reticence to prescribe sleep medication, I ultimately decided that her situation warranted a prescription. Although she received relief and began sleeping soundly, I still kept my eyes open for any detrimental side effects. 8 months after she'd begun taking the medication, Jennifer bounced into my office with a broad smile on her face. Sitting down near me, she proudly announced, "I don't need the sleeping pills anymore." More than a little bit surprised and curious, I invited her to share her secret. "Well," she began, "I went to Colorado to visit my college roommate and was curious if marijuana would help with my sleep. Because although the meds have helped me sleep, I'm honestly not a fan." I nodded along as she shared her story. Pulling a chocolate bar wrapper out of her purse, Jennifer offered, "My friend took me to a dispensary where I bought this chocolate bar called Midnight that was supposed to help with sleep. It was legal there, and I tried it for a week. It was so helpful. I'm just wondering if you can prescribe it for me. Dr. Siegel, I sleep like a baby. Not only do I not toss and turn at night anymore, I finally wake up feeling refreshed." At the time, I was vaguely aware that medical marijuana was legal in New York State, and physicians were able to become certified to recommend medical marijuana for the relief of a very discrete set of ailments. They are not technically prescribing, as I will explain later, but I didn't know that yet. But like a lot of people, I didn't have a lot of experience with marijuana. I had no real information about its efficacy and safety. So why would I, as a physician committed to the health and well-being of my patients, even consider prescribing marijuana? Before Jennifer left that day, I told her I'd consider it and do a little research. I soon learned that doctors with an active medical license in the state of New York could take an online course, register with the Department of Health, and get certified as a provider who can certify patients to obtain state-regulated medical marijuana. Over the next few weeks, I read every reputable study about cannabis I could get my hands on, and I continued to think about how Jennifer had been helped by something I really knew so little about. As I researched online, I discovered an upcoming conference at UCLA on medical marijuana, and with the support of the Amen clinics, I attended. What I learned surprised me and made me even more curious. Thus began my journey into exploring this new potential for helping patients. Based on what I was discovering, I became certified to recommend medical marijuana use in the state of New York. A second encounter, outside the walls of my office, confirmed for me that marijuana could indeed help those who suffer. I was sitting on the sidelines at my daughter's soccer game when I was approached by Jane, a woman I'd known for a few years as the mother of one of my daughter's friends. Jane was the mother of 3 children, 2 in middle school and a high schooler. She seemed to be happily married, and I knew that she worked as an editor at a popular magazine. Dropping a backpack on the grass, Jane unfolded her sports chair and sat down beside me. We greeted each other, and I returned to watching the game. "Rebecca," Jane said, in a tone just above a whisper, as she leaned toward me. "I was diagnosed last month with breast cancer." "Oh, Jane," I said, trying to match her volume. "I'm so sorry to hear that." "The doctor has recommended chemotherapy," she continued, "and I've heard such terrifying things about the side effects some women experience. My sister-in-law suffered so much when she was being treated. I've decided to receive the chemo, but I'm so scared of what I'll have to deal with." "I understand," I sympathized. Jane added, "I know that they offer medications for nausea caused by chemo, but I don't want to take those. I read an article saying that cannabis can help. What do you think?" Nodding, I confirmed, "I definitely think it's a possibility. I've had patients who've responded really well to it." "Can you prescribe it for me?" she asked, hopefully. A week later, Jane was in my office, and we were reviewing the benefits and potential pitfalls of taking cannabis to soothe the side effects of chemotherapy. At the end of our appointment, I had certified her for medical marijuana, and she could visit a local medical dispensary to obtain medical marijuana to help ease the potential adverse reactions to her treatment. Certification was good for 1 year, and I encouraged her to follow up with me. This highlights the difference between prescribing and certifying. When I certify patients for medical marijuana, it is a certification that allows them to obtain products from a dispensary for a year. They must consult with pharmacists and others at the individual dispensary to obtain products. I encourage patients to follow up with me, but I can't force them. When I prescribe medication, I insist and require that they follow up with me every 2 months. 3 months later, I ran into Jane at the girls' school. Her head was covered in a scarf, and she looked pale. "Jane," I inquired, "how are you feeling?" "Not great," she confessed. "I'm pretty tired a lot of the time. But I have not had the kind of nausea and vomiting I'd heard about from my sister-in-law. I've been using the marijuana after each treatment, and I think it has helped. So thank you." "Of course," I said. "You're a strong woman, and you're a fighter." A year later, Jane sent me a note saying that she'd finally been declared cancer-free. She thanked me again for helping her on her healing journey. Jennifer had ignited my curiosity about the medical benefits of cannabis. Jane, and others like her, allowed me to see how it reduced physical suffering. But it wasn't until I met Heather that I witnessed how emotional suffering could be eased with medical marijuana. Years prior, Heather had only been certified as an EMT for 18 months when she and her work partner, Ken, received an emergency call to rush to the World Trade Center. Although there was little information available, it sounded like a building had collapsed. By the time Heather and Ken made their way into the southern tip of the island of Manhattan, complete chaos had erupted in the streets. The air was filled with smoke, making it difficult to breathe. With traffic at a standstill, the pair had to drive their vehicle on sidewalks in an attempt to get close to the wreckage wrought by terrorists on that fateful day in September. When they finally made it, both buildings of the Twin Towers had fallen, and their job was to rescue and treat those who had survived the disaster. Heather worked into the night and through the next day, before collapsing beside her ambulance. What she experienced in those long hours would stay with her forever. Like many who witnessed the horror of that day, Heather suffered from post-traumatic stress disorder, PTSD, as a result. And in the years that followed, Heather would continue to witness and deal with the results of countless horrific accidents, as well as the results of calculated violence. And although she dealt with each one with competence and professionalism, the effects of trauma made a home in Heather's body. Even when she wasn't on the job, the weight of all she'd witnessed was something she felt every day. In 2018, Heather had sought help from a trained counselor. Unbeknownst to the counselor, Heather had discovered that if she vaped marijuana before each session, she was better able to face the difficult memories of her past and deal with them once and for all. Although she consumed marijuana illegally, the drug calmed her and put her in a better space to process the traumas she'd endured. That same year, Heather visited me in the hopes of finding a cannabis treatment that was safe and legal. In New York State, medical marijuana can be recommended for someone suffering from PTSD. However, due to the respiratory issues Heather suffered from inhaling smoke and debris the day the Twin Towers fell, smoking marijuana irritated her lungs. Through her own experimentation, she'd discovered that she liked edibles because, once they kicked in, the effects lasted for a longer time than smoking or vaping anyway. So Heather, with my direction, tried other forms of cannabis, including capsules and tinctures. In Heather's case, cannabis not only gave her momentary emotional relief, it actually helped her to do the deep healing work of processing what she'd endured. Since being certified to recommend medical marijuana, I've seen it help countless individuals who were suffering physically and emotionally. While it hasn't been the answer for every one of my patients, I've witnessed remarkable medical and psychological benefits in my patients and heard about other noteworthy results from other practitioners. In this audiobook, you'll meet some of those who have experienced the benefits of medical marijuana, and some for whom it was not useful. But you'll also discover how much we still have to learn about the benefits and risks of medical cannabis. It is my hope to share the best information we currently have for the good of those whose lives might be changed by it. Marijuana Basics. 1. What is marijuana, and is it dangerous? The myth of harmfulness. All marijuana is harmful. The myth of harmlessness. All marijuana is harmless. Oh my gosh, look at that. A friend of mine who lives in a state where both recreational and medical marijuana are illegal was standing in line at a gas station behind a group of high school girls, waiting to pay for a soda. One of the girls squealed when she noticed that gummy worms containing a compound called CBD were being sold at the counter. "What?" her friend responded, innocently. "That!" the girl said, pointing to the plastic display rack featuring the gummy candies. "You know what that is, right?" Her friend hedged. "Not really." "It's marijuana! That's what's in marijuana!" the girl exclaimed. She wasn't entirely right, and she wasn't entirely wrong. "My purse is made from marijuana," another girl playfully added. "See?" she said, pointing to the label. "Hemp!" All the girls started giggling. The story my friend shared isn't uncommon. Language around marijuana can be confusing, and it begs that core question of whether or not marijuana is harmful. If marijuana, or some part of it, is available at the gas station, it must be harmless, right? But if it's still illegal, then it must be harmful, right? Those are the questions we'll be digging into together. The world of cannabis. Today, as marijuana emerges from the recent shadows of purely recreational use and into the spotlight of increasingly greater medical use, everyone seems to be talking about it. That's why I want you to have the best information available. Cannabis, a genus of flowering plants originally indigenous to Asia, is the plant from which marijuana is extracted. The cannabis plant, or Cannabis sativa, has a stiff vertical stem and long, narrow, pointy green leaves with serrated edges. Marijuana is made from the dried flowers and leaves of the cannabis plant. Some varieties of cannabis are cultivated for non-drug use. The cannabis plant is called hemp when it refers to varieties of the species whose fibers are used to make sturdy fabrics, rope, and paper. But at dinner tables, medical offices, and school buses, most conversations about cannabis aren't about stylish purses or hemp-made twine. More often, discussions center around the plant being cultivated for both recreational use and medicinal use. The cannabis plant contains compounds called phytocannabinoids. When these chemical compounds are received by cannabinoid receptors found throughout the body, they are transported to the brain and can produce a variety of physiological effects. The cannabis plant contains over 100 different phytocannabinoids. The two at the heart of the conversation around marijuana are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. CBD. CBD does not produce the high in users that's often associated with marijuana use. So, while the high school girls were close to being right in knowing that CBD was extracted from the cannabis plant, their titillation was unfounded, since CBD doesn't produce the mind-altering effects, the feeling of being high, that was implied. A common misconception about CBD is that it is intoxicating. Because it has been demonstrated in studies to be helpful for mood, decrease anxiety, prevent psychosis, and reduce cravings, it actually is a psychoactive substance, but it is considered non-impairing or non-intoxicating. The popular thinking that THC is the recreational part of the plant and CBD is the medicinal part of the plant is reductionistic. THC has both recreational and medicinal purposes, but CBD, known for its medical effects, doesn't induce the kind of pleasurable effects that would make it popular for recreational use. The artificial division also fails to account for what is known as the entourage effect. This means that there is a unique and powerful way that all of the various components of the cannabis plant are experienced when consumed together, rather than separately. The CBD compound is extracted from both marijuana and from the flowers of the hemp plant. This non-intoxicating extract, reportedly included in the gas station gummies, is the popular substance being recommended by doctors in states where it is legal to help treat a number of medical conditions. CBD is the same compound whether it's found in marijuana or hemp. Hemp-derived CBD oil contains high concentrations of CBD, but its THC content doesn't exceed the legal 0.3% limit. CBD from marijuana may contain significant amounts of THC, ranging between 5 and 30%. As of this writing, CBD products derived from hemp are legal at the federal level throughout the United States, but individual states have the final say when it comes to the legalization and regulation of these products. Companies can legally grow, manufacture, possess, and sell CBD hemp products. Transporting these products across state lines is legal too. CBD can be found in over-the-counter products in pharmacies, health stores, and gas stations. CBD products from hemp are labeled as dietary supplements, and sellers are not allowed to make medical claims about them. Hemp-derived CBD is what you will find in skin care and makeup at your local drugstore. CBD derived from marijuana is very different. It can only be found in medical or recreationally legal dispensaries, depending on the state. Currently, 33 U.S. states have medical marijuana programs, and CBD derived from marijuana is available to eligible patients, along with other THC and combination products. As of this writing, the recreational use of marijuana is also currently legal in 15 states, as well as Guam and the District of Columbia. In these states, marijuana-derived products are available in dispensaries to individuals 21 and over. The hitch, and the danger, is that because hemp-derived CBD products are not currently federally regulated, there is no way of telling exactly what is in them. It's no wonder that teenage girls, my friend, and others can get confused. THC. The part of the cannabis plant that gives many users that feeling of euphoria is THC, which is similar in chemical makeup to CBD. However, THC can affect thinking, memory, concentration, coordination, and perception. Though we're still learning about the ways THC affects the brain, we know that its effects vary from person to person. One college student who smokes his first joint may experience the stereotypical high portrayed in movies about stoners and potheads. Another student may feel no effects after smoking her first joint. Yet another student may smoke a joint and then experience headaches, anxiety, and nausea. We also know that depending how THC is processed and ingested, it can be delivered in varying potencies. When marijuana is recommended by doctors and delivered by a licensed medical dispensary, the user knows exactly what is contained in her dosage. However, when marijuana is sold on the street for recreational use, there is no way of knowing how much THC it contains. And yet, states like New York, the one in which I am licensed to practice, believe that the THC in marijuana has benefits that are helping those who suffer. In July of 2018, the New York State Department of Health issued a report citing that the positive effects of a regulated marijuana market outweigh the potential negative impacts. Medical marijuana. Increasingly, the scientific community and the medical community are recognizing, studying, and quantifying the benefits of medical marijuana. While the criteria to qualify to receive recommendation for medical marijuana vary from state to state, the state of New York has the following guidelines. You are potentially eligible for medical marijuana if you have been diagnosed with one or more of the following severe, debilitating, or life-threatening conditions: cancer, HIV infection or AIDS, amyotrophic lateral sclerosis, ALS, Parkinson's disease, multiple sclerosis, spinal cord injury with spasticity, epilepsy, inflammatory bowel disease, neuropathy, Huntington's disease, post-traumatic stress disorder or chronic pain, or any condition for which an opioid could be prescribed. The severe, debilitating, or life-threatening condition must also be accompanied by one or more of the following associated or complicating conditions: cachexia, or wasting syndrome, severe or chronic pain, severe nausea, seizures, or severe or persistent muscle spasms, PTSD, or opioid use disorder. In my practice, I've seen patients with a variety of conditions, most frequently chronic pain, PTSD, inflammatory bowel disease, and cerebral palsy, benefit from medical marijuana. Evidence has also revealed that medical marijuana has been proven to alleviate pain, discomfort, and nausea associated with the effects of some cancer treatments. And the use of medically approved CBD has had remarkable results in children suffering from countless daily epileptic seizures. Scores of other patients will testify to the ways it has benefited them. Although most medical professionals agree that more research is needed to fully understand how marijuana in general and THC in particular affect the brains and bodies of users, it is already providing hope for many. Wondering whether medical marijuana is right for you? Here are a few steps you can take to find out. 1. Determine if medical marijuana is legal in your state. Because
Sample complete. Ready to continue?